Morning everyone. We did some of the simple innovations at RP Center. So as Dr. Srishan has earlier showed, in case of mature cataract, there is going to be collection of liquefied matter within the lens. So there is a risk of Argentine flag sign. So in those cases, the existing AIOC2020 modalities may not be able to show what is the extent of fluid collection. So what we did is, like, I was doing some innovations on smartphones. So the 840 nanometer posterior segment OCT, we were working on that one to increase the depth of choroidal imaging. But I kept 20 diopter lens, which we use for retinal examination, and accidentally it was able to converge the rays, and it was able to image the anti-segment structures, and it will image from anterocapsule to posterocapsule. So that's how we can take out the advantage of this one, and you can image the intralenticular changes in mature cataracts. So here, prospectively, the patients who are undergoing cataract surgery at our center were included, and the MSc cases were evenly included. And after getting written informed consent from these patients, patients underwent surgery. So that is the posterior segment OCT, simple 20 diopter lens which you use for retinal examination. You can stick onto that aperture, and using a single simple micropore tape, you can attach that one, and you can detach that one. You can image the posterior segment. By attaching this one, you can image the anti-segment structures. So study population included over a period of time, we totally screened 300 patients. Among those, we included 42 patients who were having mature cataracts, and these patients were in detail examined on slit lamp, followed by on OCT. So on OCT, we categorized these patients into 3 categories. Stage 1, you can see this is an anterocapsule, and you are able to see the arrow show small hyporeflective spaces or hypoechoic spaces. So that means there is an early denaturation of the lens matter, and there is a collection of liquefied matter in terms of small pockets. And these small vacuoles we termed as the early lamellar separation or stage of vacuolation. That is stage 1. So these are going to be around 50 to 100 micron from the anterocapsule. So in this case, you can see the anterocapsule, it is like bit flat. It is not that convex. So there is a little risk of Argentinian flag sign. Similarly, as you move on to other stage, the hyporeflective cavities are becoming larger in size. There is a widening of the hypoechoic spaces, and there is a much increased amount of collection of liquefied matter within the lens. These are stage 2. These are stage 2, and we term these as established stages of early lamellar separation. So this we can observe up to 1000 micron from anterocapsule. So again, you can see anterocapsule has become little bit more convex, but again there is little bit lesser collection of liquefied material. So obviously these are not going to have Argentinian flag sign. In stage 3, the skeletal framework of lens matter has been damaged, or it has been collapsed significantly. You can see the whole blank area in a map kind of area. So that is all collected liquefied matter. The moment you can see the anterocapsule is much more convex, like a obese person tummy. So the moment you put the needle on that anterocapsule, it is going to cause sudden rupture of the or sudden opening of the anterocapsule. So this is how, by simply examining these MSc patients, mature cataract patients on OCT, by simply modified OCT, you can assess whether these patients have very little collection of liquefied matter or this kind of picture. So these patients develop Argentine flag sign. So this you can observe up to 1500 microns from the anterocapsule. So this is how 3 stages were defined. First one, stage of early lamellar separation or vacuolation, stage of established lamellar separation, and third is a stage of liquefaction. So stage 1, 2 are going to have lesser risk of Argentine flag sign, and stage 3 are going to have increased risk of Argentine flag sign. So these are some of the atypical situations. In one MSc, we were able to see the hyperreflective capsule as well as the subcapsular lens matter, but rest of the details were not visible. So see, these are the challenging cases. We don't know exactly whether there is a collection of liquefied material or not, and this patient might end up with Argentine flag sign also. And in another case, you can see the anterior-cortical matter is clear, but lens matter, the nucleus is showing more of lamellar separation rather than the cortical matter. So this is again unusual cases, and amongst 42 cases, these were the 2 unusual cases. So what was known, the mature cataracts carry high risk of complications. So, and these studies, mature cataracts have been studied in literature by 2 people. One is Dhami from Punjab. That article is there in JCRS. So they have showed with fluid and without fluid. That has been published. And recently, Dr. Titya et al., they have showed using microscope integrated IOCT during intraoperative exercise. They showed how the fluid is getting egressed from the anterocapsule capsulotomy. So this is a 2 established studies in literature, but we need to have some simpler approach. For all the people in India, they need to have some simpler approach. So they may not be having sophisticated MI OCT or anti-segment OCT. So in those cases, when you have posterior segment OCT, just keep the 20 diopter lens. You'll be able to image the lens, and you will be able to get the information. So thank you.